Hello everybody, welcome back to our channel. I'm Dr. Amel from City Skin Clinic. If you're new to our channel, we're an aesthetic clinic based in London, and this is a channel just to share with you some of the insight that I've gained over the years providing aesthetic treatments at our clinic, and also to dispel the myths and give you the facts on all things skincare, beauty and aesthetics related. We don't perform any surgical aesthetic procedures. However, in this channel, wherever I think there's something relevant, so we get asked a lot about surgical procedures and we discuss them as options with our patients, even though it's something that we don't offer. And the important thing about that is that it gives them, all our clients, choices. So if you're new to our channel, welcome. Please don't forget to subscribe to our channel. If you are returning, then welcome back. So today's video, I wanted to talk about treatments for under eye bags. This is a tricky kind of area to treat. And there's a lot of kind of confusion about what might work. Lots of products and services make a lot of claims, and I thought I would just give you kind of some simple truths about what can help, what might not help. This will focus mainly on non-surgical treatments, but there are times, as you know, when only really surgery will benefit, and I'll also discuss when you might be thinking about that. So under eye bags are kind of pockets normally of just fat in this area, or they can be loose skin, or to cause that appearance, or it may be that some people are prone to fluid retention, and so you may have fluid collecting over here. The most common cause for having them is just as we get old, the fat compartments of the face shrink and we may end up with just an imbalance. And that can give rise to the appearance of bags. And I've just put a picture up here just to try and explain the underlying process behind that. And so really, you know, with the under eye bags, whether you get them or not, it's a bit like under eye circles and a lot of other problems. There is a hereditary component, so it may be something that runs in your family, and so it's something that some people are just more likely to get them than others. You know, age also is a big factor for them. And then things that kind of exacerbate and make them look worse are things like your kind of diet, especially if you're prone to fluid retention. There could be an underlying medical problem, or it could be a lot of salt in the diet, or a combination of these things. Obviously, sleepless nights don't help, and that kind of thing worsens the appearance of them. We see under eye bags in our clinic that are caused by, also they're not true under eye bags. If you have under eye hollows, so tear troughs, this may give rise to the appearance because you'll have a separate line here, and you'll have kind of the cheek area, and then there's a hollow here, and then you have this eye hair area here, and that gives rise to the appearance of bags. In that situation, these are kind of pseudo under eye bags. They appear like bags, but really the cause is this kind of separation. And in those situations, if we treat the under eye hollow with tear trough fillers, that actually removes that step between this area and this area, that junction, and then you get smoothness and the disappearance of the under eye bags. But what we haven't done is we haven't removed the under eye bags, we've just reduced that hollow that was exacerbating their appearance. For a lot of people, that is a really good result. We obviously speak with patients and tell them what is achievable and what's not, but you can get a really nice, natural looking result. You can't remove under eye bags with tear trough fillers, but you can improve the under eye hollows and improve the appearance. If someone has true under eye bags and they have a hollow, you can make the under eye bags look less obvious by sort of treating the under eye hollow itself. So tear trough fillers are a really nice treatment for that, but it's an indirect way of treating it. You're not actually treating the bags themselves. And that's something that's really important because we get a lot of questions about tear trough fillers for under eye bags. The other things that can help are if you have under eye bags, you don't really have much of a hollow, but you have a lot of volume loss in the mid-face, then cheek fillers can help restore the volume in the mid-face and just lift the kind of this area a little bit here, and that can improve the appearance of under eye bags. There is a caveat though, under eye fillers or cheek fillers, if they're kind of placed in the wrong location or the wrong type of filler is used, that can have a worse effect. It can actually lead to the appearance of under eye bags, or it can lead to the worsening of existing under eye bags. So if you use fillers in the wrong area and they push down on the lymphatics, which are little channels that drain fluid from the face, this can actually cause fluid to collect, and you can end up having the appearance of bags in the under eye area, which is not a great result if someone is looking to improve the under eye area. The other thing that can happen is if under eye filler is placed too superficially, this can give rise to lumps, and it can also give rise to fluid collecting, and again you will get a look of under eye bags. Another thing that can happen is the wrong type of filler. So in our clinic we only use Teosyol Redensity 2 for under eye fillers, and that's because it's not hydrophilic, so it's not going to attract tons of water, and that's really important. There are plenty of other awesome reasons to use it as well for under eye fillers, including the fact that it's the only one licensed for use in that area. But this is to explain the thinking behind that. So there are some amazing fillers that you can use for other things, but they're more hydrophilic. So, for example, we love Juvederm Fillers, but we would never use them in the under eye area. We use them for everything else. And that's because they can draw a lot of water. And if you place a filler in this area, but it draws a lot of water, that can cause swelling that can persist for a long time, sometimes even long after the filler has gone away. So it's so important to, if you're considering these treatments, to sit down with your practitioner and just ask all these questions and have that discussion. That's really, really important. And just to make sure that it's the right treatment for you and that the risks of this and other stuff are minimized as well. So these are kind of the main non-surgical aesthetic treatments. I know people do other things, ultrasound or radiofrequency treatments or that sort of thing, but this is kind of what we do in our clinic. Those are kind of the non-surgical treatments that often can work for a certain type of under eye bag. And again, it's about managing expectations. So if you have really large under eye bags with fat in them and there's not a lot of in terms of under eye hollowing or anything like that, then fillers are probably not going to work for you. If you're someone prone to swelling, fillers may make the situation worse. So there are many ways to kind of think about when that's not appropriate. So if you have under eye bags that are caused by fat, you've got extensive kind of skin aging, the bags are quite extensive, then actually you need to consider surgery. And there's a really good surgical procedure that removes these pockets of fat and tightens up that skin, and they bury kind of the scar in an area you can't see it. In order to get good results, it's important that you see a professional. This is a really, really skilled procedure. It needs a specialist kind of surgeon, an oculoplastic surgeon, who specializes in operating in this area. So it's really important to go and see someone like that who is qualified, experienced, who can talk you through your options. But it's really important to think that sometimes actually this may be the only option, and so this is something that if we see in clinic someone who we think actually we're not going to be able to help, but they would benefit much more from surgery. It's a discussion that we speak to patients, even patients who will benefit from our treatments. We make sure that they're aware of surgical options as well, again, so that you're armed with everything, all the knowledge that you need. If you're not ready for surgical or non-surgical treatments, if there are things that you just want to try at home before you take any further leaps, or even if you have surgical or non-surgical treatments but the result isn't exactly 100% what you want it to be, there are things that you can do to help reduce under eye bags or the appearance of them. So whilst you can't do anything about the fat or this loss of skin elasticity or loose skin or anything like that, there are things you can do to help with swelling. So one of these is look for under eye creams or under eye gels that have things like caffeine in them, and that can help reduce the appearance of under eye swelling. Also, a good tip that I tell all of our clients is put your eye cream or gel in the fridge. That will also help reduce swelling when you apply it in your face. Finally, another thing you can do is just make sure that you're sort of gently massaging when you apply your creams this area here, and that will help kind of stimulate the lymphatics and help speed up draining of any liquid and reduce the appearance of any swelling. Other things you can do is just make sure that you don't eat too much salt. A lot of us do, and it's especially found in processed foods. Try and reduce salt in your diet if you are prone to eating a lot of salt. And also, if you are getting a lot of excess facial swelling or under eye swelling, get in touch with your doctor, so your GP or your personal physician, just to check in with them and make sure that there isn't really an underlying reason that's causing you to have swelling in the under eye area. So there's a lot more information on our blog post on under eye bags, what causes them, how to treat them. I've left a link to that below. We have a lot more content coming up specifically about things like under eye bags and circles and hollows, so please keep an eye out for them. There's also at the end of this our under eye fillers video about tear trough fillers, so it's a really good video if you're interested in the tear trough fillers and what they can do. If you have any questions about this treatment or anything aesthetics or skincare related, please leave a comment below.